Welcome. Today we are doing Understanding Medicare, your 2024 roadmap. My name is Rose Flores. I'm a licensed agent in 11 states, pretty much up and down the I-75 corridor, and then going a little bit more, I'd say, southeast. So here's a little bio about me. I've been in the insurance business for approximately 20 years, so I think you're in good hands today. So we're going to go through the basics of Medicare. I'm going to go through the basics. I'm going to kind of divert and go off onto a couple of exceptions and a few other things down the road, just to kind of help answer some questions. Speaking of questions, there is a question box on your screen. So if you have any questions, please put them into the question box. And at the end of the presentation, I'll be happy to answer any of your questions. And if I don't get to them, I will reach out to you, and then we can talk about it in person. Okay? So here's our agenda. We're going to go through the history of Medicare, how it started, who was the first guy, that type of thing. Original Medicare, what's Part A, what's Part B, what's Part C, and what's Part D, okay? Those can be very confusing. Then we are going to go through three options that you have in addition to Medicare, which would be a Medicare supplement. I always recommend that you do get a prescription drug plan and a Medicare Advantage plan. We're going to go through how those work, which one would be a better option for you. Then we're going to go through the enrollment periods as to when you can enroll into these plans. And then, as I said, we're going to go through the questions at the end. So it was signed into law by President Lyndon Johnson, and President Truman was the first Medicare beneficiary. It was expanded to cover disabled people. So once you're disabled for 24 months, on the 25th month, you will get a Medicare Part A and B card. And then in 2003, the Medicare Modernization Act became law, and it modified Part C into a Medicare Advantage plan and created Part D. So back in the day, and I'm going back to like 2005, it used to be around the first of the month, you would see all the seniors come into the pharmacies and, spend most of their Social Security check trying to get their medications. Well, the government stepped in and said, that's not necessarily the way we want our people to retire and go through their golden years. So the government did step in and create the Part D plan, which has been a real money saver for lots and lots of people. So obviously there are plenty of people on Medicare, and at least half of them are on Medicare Advantage plans. So what do I need to do, or what happens for me to become Medicare eligible? Well, you can be turning age 65. You can be on Social Security disability for the 2 years, and on the 25th month, get your Medicare check. You can be over 65 and losing employer coverage. Now, this one has become a really big topic because, you may have a younger spouse, so you're waiting for them to come onto Medicare. So there's a boatload of reasons to delay going on to Medicare, as well as if you have any financial or cost of living concerns. So there are options available to you. And depending upon the plan type, you must have both Medicare Parts A and B. And we're going to go over what those are. Okay, so Part A covers your hospital stays. It's a semi-private room, general nursing, miscellaneous services and supplies. There is a $1,632 deductible, and that's an event deductible, and I'll go through that in just a minute. It does cover skilled nursing and facility care, hospice care, and some home health care. It is extremely limited. And then Part B covers the doctors, outpatient medical and surgical services and supplies, clinical lab tests, durable medical equipment, and preventive services. So, how much does everything cost? So, in original Medicare Part A, if you've worked 10 years or 40 credible quarters, Medicare Part A is at no cost to you. If you haven't worked those 10 years or 40 credible quarters, it could be up to $505 a month for Medicare Part A. It does have deductibles like that $1,632. That is an event deductible on your hospitalization. So for instance, let's say in February you went into the hospital for a couple of days. You pay that $1,632. And then let's say in August you had a really bad year and you had to go back to the hospital. You'd pay that $1,632 all over again. It's an event deductible. And then there are copays if you go beyond 60 days. There's a per day fee. And then skilled nursing, the government gives you the first 20 days. And then after that, it would be $204 a day for days 20 through 100. And they will give you 100 days of skilled nursing. And then after that, it's all at your cost. If you are collecting a Social Security benefit check, you will automatically be enrolled in Part A. If you are getting a Social Security benefit check prior to 65, you will get your Medicare card in the mail. They will automatically send it to you. You have the option of keeping Part A. You keep Part A because that's basically at no cost to you if you've worked those 10 years or 40 credible quarters. But Part B is going to have a fee. So you do have the ability to decline Part B, especially if you're working or you're on your spouse's plan or something like that. And then we recommend that if you're going to be applying around the age of 65, that you start the process 3 months before, because it does take the government a while to process your application. There are forms that you have to complete. You can do it online. You can call them up and set up a phone conversation. You can go into their office, and very limited, and schedule a time to get your enrollment for Medicare Parts A and B taken care of. So, what's Medicare Part B? This is the doctor, outpatient surgery, durable medical equipment type thing. Medicare Part B, unlike Medicare Part A, does have a cost associated with it. And currently, if you are single making $103,000 or less, or filing jointly making $206,000 or less, your Medicare Part B premium in 2024 will be the $174.70. And they are going to be looking at your income from 2 years ago. So they're looking at 2022, and then when 2025 comes around, they'll be looking at 2023. So in this particular situation, if you have like Medicaid, you could have your Medicare Part B premium paid for you, depending upon what level of Medicaid you have. And then if you are making more than the $206,000 filing jointly, you will pay more based on the IRMA, income monthly related adjustment amount. And then in Medicare Part B, there is a $240 deductible that you are responsible for paying. And then Medicare pays 80% of the approved medical services, and then you would be responsible for 20%. But just be aware that that 20%, unlike your group plan or your individual plan that you currently have now that has an out-of-pocket maximum, this plan does not have an out-of-pocket maximum, so that 20% can go on into infinity and can be very expensive. That's why we recommend that when you do get your Medicare Parts A and B, that you do consider looking at a Medicare supplement, a Medicare Advantage plan, a prescription drug plan, just to protect yourself from that risk. And so let's go on. So here are the rates. I'm going to leave this screen up for just a minute because the first column is just going to be, you know, if you're an individual. The second column is if you're filing joint, and then filing married and separate tax return. And then on the last column is what you can pay, what you would pay monthly per person for Medicare Part B. Okay, and please note that if you are getting a Social Security benefit check, they will take your Part B premium out of that check. The government's going to get their money before they give you any of it. If you are not getting a Social Security benefit check, they will bill you quarterly in advance for that. Okay? So, what do I do? Okay, I got a group plan, and there's Medicare, and I'm turning 65, or I'm over 65, and what would be, you know, the better situation for me? So if you're on a group plan, you may have better drug coverage, because that drug coverage goes towards your out-of-pocket maximum. In Medicare, that does not occur. High wage earners have a better rate because they are not assessed the upcharge for IRMA, and then they may have higher deductibles and out-of-pocket costs on the group plan. Usually Medicare has very small deductibles and copays or various other things going on. Then Medicare may have a lower cost. You know, some of the premiums could be at no cost to you. Some of the premiums could have a, you know, a rate depending upon what plan you go with. Their deductibles, they may vary by plan, the limited out-of-pocket costs. So in the Medicare portion of it, remember when we were talking about Medicare Part B, not having an out-of-pocket on that 20%. This particular Medicare, if you went with a Medicare Advantage plan, they would have out-of-pocket costs. And then lower wage earners may see cost savings. Okay, so what do I do? Okay, here you've put out all this information here. Do I do a Medicare supplement or do I do a Medicare Advantage plan? And what the heck are they? Okay, so let's just kind of go through them. So Medicare supplement and standalone prescription drug plan. A Medicare supplement mirrors everything that Medicare covers. So if Medicare doesn't cover it, the supplement doesn't cover it. And Medicare covers hospital and doctors, but it does not cover medications that you get from a pharmacy. So in a Medicare supplement, you will need to add on a standalone prescription drug plan. A Medicare Advantage plan with prescription drug plans, they come with them or without. Usually the ones I sell are with the prescription drug coverage. And these are usually set up for people that, have a limited budget. They're not really going to travel much, that type of thing. There are plenty of options. The carriers, whether it be Humana, Aetna, Medical Mutual of Ohio, United Healthcare, the list goes on and on. They are going to have a variety of options, both on a Medicare supplement and as well as a Medicare Advantage plan. The pricing is going to be different. A Medicare supplement is usually going to be more expensive. And then as far as availability, that's based on where you live. You have a service area. So if, for instance, the state of Ohio is a service area. In the world of the government, Kentucky and Indiana are a service area. So if you move from one service area to another service area, you do have to get a new prescription drug plan or a Medicare Advantage plan. The Medicare supplement is portable and it travels really well with you, so you don't have to change that. And then, of course, there's the enrollment time frame, and fortunately, we are just looking down the throat of AEP, which starts on October 15th and rolls through December 7th. And then all of the coverages may vary, so depending upon what plan you do decide to get. Okay, I'm sorry, I was just looking at some questions. And then you need to choose a plan that fits your personal needs. Okay, do you travel? Is dental, vision, and hearing a big thing for you? Basically what we do here at Arc Benefit Solutions is we are more of a consultative type of agency in that we want to know more about you and what your needs are. And then we take our knowledge and show you plans that fit what would be good for you, okay? And of course, we give you several options so that, it's not just like, here's your plan, have a good day, type of thing. We actually will explain the plans, walk you through the plans. We're always here, in case you have any questions. I'm never more than a phone call away, so don't hesitate to give me a call. And there are no family plans. Medicare is everybody has a separate plan. So on the Medicare Part B premium, that's per month per person. So it's not like on a group plan where you have I lost my train of thought. Where you have an employee and a spouse and children. Finally got it back. Good. All right, so the next one is, okay, so here's a Medigap, which fills in the gaps. It's a Medicare supplement, affectionately termed a Medigap, which fills in the gaps of Medicare. So it takes care of that hospital deductible of $1,632. It takes care of that skilled nursing, $204 a day for days 20 through 100. It can take care of the 20% coinsurance, and there are copays. So basically, a Medicare supplement, other than the $240 deductible that you are responsible for paying, then you shouldn't really have any out-of-pocket costs for Medicare-approved services, hospital and doctor, for the rest of the time that you're on the plan. Now, there are, Medicare covers certain things, like Medicare does not cover, like dental, doesn't cover, like eyeglasses, but does cover diseases and conditions of the eye. And then the plans are offered by various insurance companies. We take care of, or we offer the more tried and true plans for you to consider. You can go to any provider that accepts Medicare. It travels really well. All plans are the same. So if you're looking at a Plan G, which is very popular these days, then the plan is going to be the plan is going to be the plan. So an Aetna plan versus a Humana plan versus a medical mutual plan or United Healthcare plan, their Plan Gs are all going to be the same plan. There will be little tweaks. Some of them may offer you like silver sneakers. They may offer you household discounts, and a household discount is if you and your husband decided to enroll both in the same carrier plan. It doesn't have to be at the same time. They will always catch up with you. And then going forward, when the other spouse does join in, then both the original policyholder and the new policyholder will have a percentage of a household discount taken off of their premium. Super cool. And so, prices may vary by plan type, insurance company, location, your age, your gender, your health status, and whether you're a smoker or not. Okay, and here are the variety of different Medicare supplements that are out there. You will see that there is a Plan F and a Plan C here. Those particular plans are no longer available to anyone who ages in after January 1st of 2020. So you can't go into a first dollar plan. And what I mean by first dollar plan is that it covers that Part B deductible. So you can see if you're looking at the Part B deductible and you go over there, the only two that cover that are the C and F. So Congress decided that they didn't like plans with a first dollar amount coverage, and so they decided to limit the enrollment to be cut off on January 1st of 2020. So obviously when the government steps in and they say, oh, you can't do this, then the insurance companies come in and go, I think we have a solution. So then they came out with the Medicare Plan G, which, as you can see, if you go by the Part B deductible, you are responsible for that. Okay, Medicare Part D. Oh my. The government says that when you turn 65, you voluntarily can enroll into a prescription drug plan. They got a strange definition of voluntary, because if you do not enroll into a prescription drug plan when it is first made available to you at age 65, or when you're coming off of group, or for whatever reason, then, and you decide not to enroll in a prescription drug plan, and then later on down the road enroll in one, you will be hit with a penalty. And that penalty is 1% for every month that you were able to enroll in a prescription drug plan but didn't. And that's 1% of the average premium. So let's say it's 35 cents. So 35 cents, and you're out for 10 months and you didn't elect it. Now you have an election period, so you can go into a prescription drug plan. You're going to be paying $3.50 more than what the premium is going to be, and that would be to the government. Okay, and then you can purchase from private insurers, not the government, the Part D. So the government just wants to play with A and B. They don't want to have anything to do with a Medicare supplement, a Medicare Advantage, or a prescription drug plan. They want to leave that to you, or leave that to you and your agent to discuss those options. You can get a standalone prescription drug plan on its own, or you can get it married up with a Medicare supplement, or it can be included into the Medicare Advantage plan. So The plans do vary by county and the pharmacy. There are pharmacy networks. There are preferred pharmacies where you're going to get more bang for your buck. And then there are standard in-network pharmacies where you can still go to that pharmacy, but you're going to pay a little bit more. Okay? There are different drug formularies, so each carrier must have at least 2 medications in each therapeutic class. So whether you have cholesterol, high blood pressure, whatever, they're required to have at least 2 medications in each therapeutic class. In reality, they have hundreds of medications. So, and they have to have a substantial formulary to be approved by the government, okay? And then drug pricing varies, and then there are deductibles on a prescription drug plan. So for instance, in 2024, there is a $545 calendar year deductible that applies. And then after that, you would have either co-insurance, which is a percentage, or a copay, which is a flat dollar amount for your medications. So, and then after that, when the cost of your medications gets to $5,030, then the cost of your medications goes to 25%. And then when you get to $8,000, you're covered at 100% for the rest of the year. Okay? And just like the Part B, the IRMA, you do get assessed an IRMA rate up if you make more money. So these rates are in addition to the premium. All right, so here we are again at the crossroads. Okay. All right, so here's a Medicare Advantage plan. Okay, so this is a totally different than the Medicare supplement. So you have a Medicare supplement where you can see any doctor that accepts Medicare, you can travel really well, you have your $240 deductible, and then you pay your premium, and the rest of those Medicare approved hospital and doctor services would be covered under that plan. So, but in this particular plan, it's more of like a group plan-esque kind of thing, in that it's a pay as you go. So you're still part of the Medicare program. You still have to have Medicare Parts A and B. Okay, you still need to pay for the Part B. And then Medicare pays the plan and amount for each member's care to the carrier. So in a Medicare Advantage plan, you'll see these on commercials, especially around this time of year and going into October and the rest of the annual election period, where they are advertising Medicare Advantage plans. They say there are no cost to you, but they are managed care plans. And you still have to have A and B. The managed care is basically the carrier. You do need to stay in network with carriers. So if you want to look at a Medicare Advantage plan, I would normally ask you for a listing of your doctors, your medications, and your favorite pharmacies, so that I can look up your doctors in the network and then provide you with quotes for the carriers that have your doctors and hospitals and medications all in network. So the Medicare Advantage plans are run by private insurance companies. They are paid by the government to help you with Medicare. So they have the ability to throw in like dental, vision, and hearing. They do come in HMO and PPO options. So you have an HMO is a health maintenance organization where you do need to stay in network. And a PPO gives you the ability to go in network or out of network. Obviously, if you go out of network, it's going to be a higher cost for you. These plans do have out-of-pocket maximums for hospital and doctors only. So when you get to an out-of-pocket maximum, basically that's when you're covered at 100%. And then, and there are plenty of plans to choose, and they all are based on that service area. So if you live in Ohio, the plan's in Ohio. And there are no medical questions. Okay. So you receive care under all care under one plan. So it covers the hospital, the medical, the drugs. They throw in those extra services like dental, vision, and hearing. It covers everything that original Medicare covers. You have to pay co-pays for covered services, visits to specialists. So it's a pay-as-you-go basis. And like preventive services are at no cost to you, but there is a list of preventive services. And some services like durable medical equipment and chemotherapy may be up to 20% co-insurance. Okay. All right, here we are at the crossroads, Medicare supplement or Medicare Advantage plan. So a supplement may have higher monthly premiums. An Advantage plan will have lower premiums. The supplement premiums may change annually on both the supplement and the Advantage plan. There are little to no copays or out-of-pocket expenses. Remember, on the supplement, especially on that Plan G, you just have that $240 calendar year deductible for hospital and doctors. Of course, you do have to get a prescription drug plan. There is the potential for copays and higher out-of-pocket cost expenses on the Advantage plan. As we said before, you can go to any provider. It travels really well on a supplement. On the Advantage plan, you do need to use network providers. And that's why we ask for a listing of your doctor's names and your medications, because we have to do our homework to make sure that we're putting you in an appropriate plan that fits your needs. It's all about your needs, okay? In the supplement, you do have to get the prescription drug coverage in addition to that. And then unless you have like VA or some other credible drug coverage. And what I mean by credible drug coverage is that it pays as good or better than what Medicare, okay? The plans on the Advantage do include drug coverage. On the supplement side, the plan's benefits never change. The plan is the plan is the plan. Doesn't matter what carrier you go to on a Medicare supplement. If it's a Plan G, it's a Plan G. The benefits are all going to roll about the same. And then on the Advantage plan, plan benefits do change annually. And some of you may have gotten your annual notice of change, which we call an ANOC. Where it is giving you, it's saying, here's what your plan is now, and here's what we're going to make as far as changes for 2025. Because on the Advantage plans, and on the prescription drug plans, they are calendar year plans. A supplement plan just keeps on rolling. And then in a supplement, when you first turn 65 and enroll in A and B, you have like 6 months of guarantee issue where you don't have to answer any medical questions on the supplement. If you go beyond that, okay, let's say you went on to a Medicare Advantage plan first, and now you're 3 years into it, and you say, no, Rose, I really want to do that Medicare supplement. You will have to answer medical questions and go through underwriting. You don't have to have physical or anything like that, but you do have to answer medical questions before they will approve you, and they do have the ability to say no. So on the Advantage plan, there are no medical questions. On the first 6 months on the supplement, you are guarantee issued, so no medical questions. You go beyond that 6 months, you're going to have medical questions unless you have a guarantee issue scenario, okay? All right, so here are some kind of costs that we can go into. Oh, there it is. So a Medicare Part A, we're making, you know, the assumption that you've worked 10 years or 40 credible quarters. And then, so that would be at no cost to you. Medicare Part B, again, we're assuming that you make less than $103,000 on a single, less than $206,000 filing jointly. And then, excuse me, the cost of the supplement, usually depending upon your age and whether you're a smoker, a male or female, those rates can range. I would say if you're aging into Medicare, usually the median range for a Medicare supplement is about $150. And then on a Medicare Advantage plan, some of those plans can be at no cost to you or could be up to $150. And then the Part D, there are some plans out there that can be at no cost to you or up to $120 per month. And then on the Medicare Advantage plan, that would be included in the plan. So you can see the difference in prices. One has all kinds of flexibility and as far as the Medicare supplement is concerned, with little to no out-of-pocket costs for claims. Whereas on the Medicare Advantage plan, you have little, premium, less premium, I should say, but you will be paying on claims as a pay-as-you-go type basis. Okay, so the qualifications for enrollment. Anyone over 65 in a Medicare supplement and has A and B. Okay, some states, not Ohio, but some states will allow you to go into a Medicare supplement before age 65. But in most cases, in Ohio, it's 65 or more. It is guarantee issue when you're turning 65 or loss of group coverage. So those of you who are on group coverage beyond 65, don't worry. Loss of group coverage opens up that guarantee issue option for you as well. And you have to qualify medically if not meeting the above, which is basically if you're not in guarantee issue, you do have to answer medical questions. So on a Medicare Advantage plan, you can enroll in that at any age. You got to have A and B. A and B are the building blocks for all of this Medicare. There are no health questions. Enrollment is limited to qualifying events, and you can change plans every year during AEP. And as I indicated, AEP is coming up. The plans have not been released to agents yet. They don't usually release those to us until the first part of October. Okay, so here are the enrollment periods. So when you, initial enrollment period is a 7-month window. So this is when you're turning 65. It's 3 months before, the month of your birth, and 3 months after. The effective date on Medicare is always the first of the month, okay? If your birthday lands on the first of the month, you get the month before as an effective date. So then there is the annual election period, which is the October 15th to December 7th, with the effective date on the policies being January 1st. And then there are special election periods that are available to you around the year, like you're coming off of group, you're moving from one state to another, all of those type of things, those, are more catered to your particular situation. So loss of group coverage, change in residency, and Medicaid eligibility. Okay, so how to enroll? So you can get personalized assistance through an agent, which I highly recommend since I am an agent. Been in the business for almost 20 years, so in the plans and what happens every year changes. So I always recommend that you get in touch with an agent to find out how your personal situation applies to Medicare, because what's good for one person may not be good for another person, okay? So, for instance, I have somebody who is I'm sorry, I was reading a question. I got distracted. So what we do is we take care of you. We learn what your interests are, what your lifestyle is about, and then we talk to you, a more consultative approach. And then if you have questions about Medicare, we're always your advocate to help you, whether it's a claim, I need my insurance cards, whatever. We're always around to help you. It may take us a day or two to get back in touch with you because it is a busy time of year that we're coming upon. And then you can always go to the carrier website, or you can call them up and enroll. And then you can always go to Medicare.gov and enroll. And then here, okay. So there is no best plan. I can't tell you how many times people call me up and say, I just want the best plan. Well, the best plan for you may be not the best plan for someone next to you. So what we do is we find out more about you, and then we cater that, your wishes and concerns to plans that we feel might fit your budget, your needs, your wants, that type of thing. There are many factors to consider: your resident address, your income, your doctors and providers, your medication needs, and your budget. So we go over all of that with you and help you along the way with helping you to make the decision into Medicare. There are a lot of exceptions. So, for instance, let's talk about group for just a minute. In the world of Medicare, they say that if you have a group of 19 or less, Medicare is first. If you have a group of 20 or more, the group is first. But there are some new small group plans out there today that kind of mess with that scenario. So you really do need to get in touch with your employer as to what kind of plan you have, you already know the carrier, but there are some association plans out there that work just a little differently. So it's always nice to talk to an agent to get the real understanding of what is going on there. So let's go into some of the questions. We're into questions. Okay, let's go back up. How much is the fee for using an agent each year? We are at no cost to you. Very few things ever in the world are free, and we are one of them. So we are at no cost to you. We get paid by the carriers. So, and I represent a lot of carriers. So it really is whichever carrier you decide upon, that carrier pays me, but my services to you are at no cost to you. Can I require an employee to go off our medical at 65? I don't think you can mandate them to do that. If he drops to part-time, can I? Oh, sure. If he drops to part-time, then if he's not working based on your, your contract with your insurance, and I think most of them say 30 hours, then if he goes to part-time, then he no longer qualifies, he or she no longer qualifies for the group plan. So that would be one way to do it. But, let's see. Yes, the slides will be available to you after the webinar. Okay. Any more questions? I think we've gone over most of the stuff here, and I really appreciate you taking the time and joining me today to go over Medicare. I can always be reached at my phone number here and my email address. I have an assistant, Emily. She's fabulous, and we sit really close to each other. So I'll call you or Emily. I don't know what NM stands for.
Never mind.
Oh, okay, great. Sorry, I don't text. So this is pretty much the end, unless we have any more questions. I can't see anything. So I hope everybody has a wonderful day, and I look forward to assisting you. Please reach out to me. As I always say, I'm never more than a phone call away, and if I don't have the answer, I'm surrounded by very wonderful agents and wonderful employers that spend a lot of time to make sure that we are as knowledgeable as we possibly can to assist you, okay? And that is our main goal, is to assist you, okay? So everybody have a wonderful day, and give me a call. I'll be more than happy to answer any of your questions, and happy AEP. Take care. Bye.